Bioethics is the study of right and wrong in medicine. It helps us make difficult decisions when there are no easy answers. Healthcare is about more than just treating diseases. It's about treating people with respect and dignity. Bioethics reminds us that patients are not just cases. They are individuals with their own beliefs, values, and goals. Ethical dilemmas arise in all areas of medicine. Orthopaedics, with its focus on bones, joints, and movement, is no exception. Bioethics helps us navigate complex situations. It ensures we are providing care that is morally sound and in the best interest of our patients. By adhering to bioethical principles, we build trust with patients. We also create a healthcare system that is fair and equitable for all. Orthopedics presents unique ethical challenges. Amputation, for instance, is a life-altering procedure. It raises questions about a patient's autonomy and quality of life. Implants, while often beneficial, can have long-term consequences. Patients and surgeons must weigh the risks and benefits carefully. Photography in orthopedics, especially for educational or research purposes, requires careful consideration of patient privacy. Informed consent is paramount. Social media presents another layer of complexity. While it can be a tool for patient education and support, it also blurs the lines between professional and personal boundaries. Sharing patient information online, even anonymously, raises ethical concerns. 4 principles guide ethical decision-making in healthcare. These are autonomy, beneficence, non-maleficence, and justice. Autonomy emphasizes the patient's right to make their own decisions. Patients must be fully informed about their condition and treatment options. Beneficence means acting in the patient's best interest. This involves providing appropriate care, considering the patient's values and preferences. Non-maleficence is the principle of do no harm. It reminds us to carefully weigh the risks and benefits of any intervention. Justice focuses on fairness and equity in healthcare. It means providing equal access to care and distributing resources fairly. These 4 principles are not always easy to reconcile. They often come into conflict, requiring careful consideration and ethical deliberation. Section 4. Respecting privacy and confidentiality. Confidentiality is a cornerstone of the doctor-patient relationship. Patients need to trust that their medical information will be kept private. This trust is essential for open and honest communication. Orthopedic surgeons often deal with sensitive information. This includes medical histories, imaging studies, and personal details related to a patient's mobility and quality of life. It is crucial to obtain explicit consent before sharing any patient information. This includes sharing information with family members or other healthcare providers. The Health Insurance Portability and Accountability Act, or HIPAA, sets standards for protecting patient privacy. Healthcare providers must comply with these regulations to safeguard patient information. Section 5. Upholding ethical standards in orthopedics. Bioethics provides a framework for navigating complex situations. It ensures that medical decisions are made with compassion, respect, and a commitment to patient well-being. By adhering to bioethical principles, we can provide the high standard of care. Ethical dilemmas will continue to arise as technology advances and societal values evolve. Ongoing dialogue and reflection are crucial for ensuring ethical practice. Orthopedic surgeons must stay informed about emerging bioethical issues. They must actively engage in ethical reflection and decision-making. By upholding the principles of bioethics, we can create a healthcare system that is both technically advanced and morally sound. A common bioethical case in orthopedics involving a diabetic patient with a gangrenous foot centers around the decision-making process for amputation, balancing the principles of beneficence, non-maleficence, patient autonomy, and justice. Case overview. A 65-year-old diabetic patient presents with a severely gangrenous foot. The gangrene has resulted from a combination of peripheral arterial disease, neuropathy, and poorly controlled diabetes. The infection has spread, leading to systemic signs of sepsis, and the medical team is considering amputation to prevent further complications, including death. Ethical dilemma. The ethical dilemma in this case revolves around whether to proceed with amputation, considering the patient's quality of life, potential risks, and the patient's wishes. 1. Beneficence. The medical team's primary concern is to save the patient's life. Amputation is often seen as the best course of action to prevent the spread of infection, reduce pain, and potentially prolong the patient's life. Non-maleficence. However, amputation is a major surgical procedure with significant physical and psychological impacts. The patient may face a prolonged recovery, loss of mobility, and changes in lifestyle, which could lead to depression and decreased quality of life. 1. The patient has expressed reluctance to undergo amputation, fearing the loss of independence and a decline in their overall quality of life. They might prefer to pursue less invasive treatments, despite the higher risk of mortality and complications. Respecting patient autonomy means honoring their decision, provided they are fully informed of the risks and benefits. However, there is a tension between respecting the patient's wishes and the healthcare team's responsibility to provide the best possible care. 1. The patient's decision-making capacity must be thoroughly evaluated. In cases where the patient is overwhelmed by the situation or not fully understanding the consequences, additional support from family members, mental health professionals, or a bioethics committee may be necessary to ensure informed consent. 2. Resource allocation and cost considerations may also come into play, particularly in a healthcare system with limited resources. The costs associated with prolonged hospital stays, advanced wound care, and potential repeated surgeries, if amputation is delayed, could be substantial. Outcome and considerations. In practice, the decision-making process would involve a multidisciplinary team, including the orthopedic surgeon, endocrinologist, infectious disease specialist, nursing staff, and possibly a bioethics consultant. The patient would be provided with detailed information about the risks and benefits of amputation versus conservative management, including palliative care options if the patient declines surgery. Ultimately, the decision should balance the patient's autonomy with the ethical duty of the healthcare team to act in the patient's best interest, considering both the immediate and long-term outcomes. In some cases, a shared decision-making approach may lead to a compromise, such as attempting limb salvage with aggressive wound care and revascularization, with a clear understanding that amputation might still be necessary if the infection does not resolve. This case exemplifies the challenges in bioethics, particularly in situations where the best medical option may conflict with the patient's personal values and preferences. A notable bioethical case involving implants in orthopedics is the debate over the use of metal on metal (MOM) hip implants, particularly in light of the complications and adverse effects reported in some patients. Case overview: a 58-year-old patient with severe osteoarthritis of the hip is recommended for hip replacement surgery. The surgeon suggests a metal-on-metal MOM hip implant, citing its durability and suitability for younger, more active patients. However, the patient later develops complications, including severe pain, tissue damage, and elevated levels of metal ions in the blood, leading to a diagnosis of metallosis. Ethical dilemma. The ethical dilemma here revolves around the use of implants that were widely promoted and used despite emerging evidence of significant risks. This case raises questions about informed consent, patient safety, and the responsibilities of healthcare providers and manufacturers. 1. Disclosure of risks. At the time of the initial surgery, the surgeon may not have fully informed the patient of the potential risks associated with MOM implants, such as metallosis, implant failure, and the need for revision surgery. Even though the risks were known to some extent, they were not always communicated clearly to patients. Informed decision making. The patient's ability to make an informed decision is compromised if they are not provided with all the relevant information, including the availability of alternative implants, e.g. ceramic or polyethylene, which might have fewer risks. 1. Avoiding harm. The principle of non-maleficence is central to this case. The use of MOM implants, which later proved to cause harm to some patients, challenges this principle. The medical community's duty to avoid harm comes into question, especially in light of mounting evidence that MOM implants were associated with serious complications. Post-surgery complications. The development of complications such as metallosis, pseudotumors, and the potential need for revision surgery indicates that the initial procedure caused significant harm, which might have been avoidable with different implant choices. 1. Balancing benefits and risks. At the time, MOM implants were chosen for their benefits, such as improved durability and reduced risk of dislocation in younger patients. However, the long-term risks, which eventually outweighed these benefits for many patients, highlight the ethical obligation to thoroughly assess both short and long-term outcomes when recommending medical devices. 2. Fairness in medical practice. The widespread use of MOM implants, driven by marketing and industry influence, raises questions about justice in medical practice. Were patients subjected to unnecessary risks because of economic interests? This question touches on the ethical distribution of risks and benefits, as well as the potential conflict of interests between medical practitioners and implant manufacturers. Recalls and legal actions. The eventual recall of some MOM implants and subsequent legal actions by affected patients also underscore issues of justice. Patients who suffered harm may seek compensation, but the legal process can be long, stressful, and may not always result in fair outcomes. Outcome and considerations. The fallout from the use of MOM hip implants led to increased scrutiny of medical devices and the processes by which they are approved and monitored post-market. For the patient in this case, the situation may result in the need for revision surgery ongoing monitoring for metal ion levels, and the psychological and physical toll of dealing with an unexpected medical complication. From an ethical standpoint, this case serves as a reminder of the importance of upholding ethical standards in medical practice, particularly when new technologies and implants are introduced.